did the physical domain intervention, and we did the dental work for children. So we did the potential problems and risks and the interventions we thought would be effective, and each of us took a different problem or risk. I honestly can't remember what one I did for presentation for so long.
Bottles and pacifiers.
I did bottles. I was like, did I do dental like cavities? No, you're right. I did bottles and pacifiers. Yes. So
I did snacking and yeah,
nutrition.
And yeah, nutrition. Thank you.
And then I did more of the brushing, the hygiene, the how-to, and all that fun jazz and all of it.
Fluoride too was another big one on yours, right?
Yeah, fluoride.
It was.
Yeah.
Which taught me a lot, by the way.
Oh, yeah. Did it? Yeah, it was news to me 4 years ago.
Yeah, paid
good money for that.
The snacking one taught me a lot too. So that was actually very helpful.
Good. Well, it was a good one because you're right. It's unique, and we were probably the only one that did that. That wasn't even on my radar as a topic to do.
Yeah, that was good because I think it was unique to any other topic that we could discuss, but so important as we learned from the research that we did.
Actually turned out really well. Mine with the bottles and pacifiers, there's a few main problems, just really quick. Most of them are people let their babies and toddlers have bottles for way too long, and that, like, if they drink anything but milk and water from a bottle, their teeth. And really, you should try to start weaning from bottles between 12 and 14 months, which was earlier than I thought. But the pacifier, I was kind of surprised that, I mean, people do let their children have them longer than they should, but it's actually safe for them to have a pacifier till they're 3. They need to get off of it. Before then, you should be kind of slowly getting off of it. By the time they're 3, they shouldn't really have it anymore. And also another thing that I didn't really think about when I first looked at this problem, but made a lot of sense, was a lot of time parents let like binkies drop on the floor, or anytime they get dirty and they don't clean them properly, and that can hurt their teeth and their gums. And telling parents not to clean like binkies with their mouth, and I was like, who does that? But then at church on Sunday, I saw a mom do that, and I was like, okay, well, this does need to be, I guess, addressed. So I thought it was kind of funny. Yeah, so that was pretty much mine in a small, brief summary.
So mine was doing on the increased snacking and how that exposes their teeth to more risk for cavities because they have sugar on their teeth, and the more that they're snacking, the longer period of time that sugar is on their teeth, and that increases the risk of cavities. And I don't know, I guess what I learned from that was, you know, they push snacks and nutrition so much, and they just, I think we forget to look at the nutrition side of snacks, but how often are they getting snacks, and is that really healthy because their teeth are exposed to that so much sugar for such a prolonged period of time that's not good for their teeth. And then the types of snacks that they also use are not good. You know, juice and sugary snacks and those kinds of things are not healthy for nutrition and for their teeth as well. So.
Something I liked a lot in yours was how it talked about, you know, instead of just giving your kids snacks whenever they want, or just, you know, all the time, to make snack time like meal time, you know, make it kind of like the event where you know, sit down, a snack a lot, because I think then you're, I guess, more aware of what your kids are eating and like when they're eating, things like that.
Right. And then it's just not mindless snacking, because I know I'm really guilty of that, of, you know, I'm eating. Why am I eating? I'm not hungry. I'm just bored, or just I'm watching TV and I have nothing else to do. And so it's just being aware of when you're snacking and how many calories you're consuming and how long your teeth are exposed to those cavity potentials. So.
definitely.
Right. And like you said, it's interesting that from the health side of it, they always say, oh, you know, have 2 snacks a day and 3 meals or whatnot. That's the most healthy. But for your teeth, it's really not, because it makes your mouth acidic for so much longer and it eats away at the enamel. And I don't feel like people ever talk about that or know that, because it's not. I don't feel like it's common knowledge because it's not put out there.
Right.
Mhm. Yeah, I agree.
Should I talk about my hygiene, or do you think it's necessary?
I would.
Yeah, just go through it super fast.
So the hygiene basically talked about what kind of toothbrush to use and that how important fluoride is, that it might be, and studies shown that it's that has the biggest deterrent of cavities is fluoride. It doesn't matter. I mean, people should brush their teeth 2 times a day, and they should floss. And it talked about the importance of brushing right before bed and not rinsing your mouth because you need the fluoride to sit on your teeth. And to use a soft bristle brush. And that's about it.
That was one thing that I really changed what I did in my habits once I read that was I always rinse my mouth out after I brush my teeth. And it made me realize that that's just taking the fluoride off of your teeth and it needs to sit on there. So that was something I learned and I'm trying to break my habit of now.
It's hard.
Yeah,
I still catch myself doing it. You know what's funny is my husband, he'll brush his teeth and he won't spit out, but he'll just keep the toothpaste in his mouth, you know, like after you brush, he'll just keep it in his mouth for like a minute while he's doing other stuff and then he'll spit it out. I can't stand doing it that long, but I don't even know that that's necessary, but he just likes the fluoride to sit on there a little bit longer.
Yeah. Yeah.
Well, that's great. Perfect. Okay, so that was definitely good. So let's go to our next one. So each of us, I can start, or if one of you want to start, that's fine. So just talk about the intervention that you studied this week, and if you have actually, if you've actually implemented the intervention, you can talk about how that went. If you haven't, talk about the research that you found of how it could be effective. Does that make sense?
Do you want to go first, Victoria, or do you want me to?
I can go. Okay, so mine was social anxiety specifically, and I found 2 really good articles. One was like extra good. So I've not actually implemented these, so I'm going to talk more about the research. So the first article I found is called "Treating Adolescents with Social Anxiety Disorder in Schools." So this talks about the actual intervention is helping them in the actual school. So I'll give you a couple statistics about this, not too many. It just says that recent estimates indicate that 6% of children and 12% of adolescents meet criteria for having social anxiety disorder. And that this fits our age group perfectly. Social anxiety disorder starts as early as age 5 and peaks around age 11 and 12. So it's right in that we're looking at this week. And so some of the problems that result from social anxiety are fewer friends, difficulty participating in classroom activities like answering questions or working in groups, and avoiding social interactions like starting conversations or like joining sports or anything like that. Okay, and most children with social anxiety disorder are not treated. They're just considered shy and for it. So the interventions, I guess I'll focus on 4 that they're all within the school for the most part. Okay, so the school-based treatment is usually group treatment, and it is ideal because the intervention implemented in the school allows for a real-world treatment approach. So basically, they actually get to practice the things they're learning where they use them. So if they're having a hard time in school making friends or participating in the classroom or, you know, just joining in on anything, then this gives them an opportunity to at the school and then practice it on a day-to-day basis. A lot of these things happen like cafeterias. Kids are scared to go sit with other groups or sit with people they don't know very well, things like that. So there's 3 things they talked about to help teach kids about how to deal with social anxiety disorder, and a couple of them are realistic thinking. And so when you're doing that, you're highlighting the relationships between thoughts, feelings, and behaviors. So some of the questions they can tell them to ask themselves are, am I exaggerating this? How many times has this actually happened in the past? Am I being fair? So it kind of helps them think about things like, have they answered a question in class and been laughed at before, or are they just scared that's going to happen? Things like that. So how realistic their fears are. And then the other one is straight up social skills training. So teaching them how to initiate conversation. So like what to say, even just like, hi, my name is Victoria. What's your name? Things like that. They kind of need help just with those simple, not that they don't know, but that maybe frees up when it actually comes to the time. And then not just starting the conversations, but maintaining them, listen and to others, and then also remembering what others say. So those are just some of the social skills that you would teach in a school-based intervention. And then the last one would be facing your fears. So this is a quote from it. It says, students practicing entering into anxiety-provoking situations while in the group or around the school. So they can practice giving a presentation, and that can be with their whole class, or it can be with a small group. It can be just with, their teacher, just to practice, or around the school. They can maybe, as part of their, treatment, can questions like, what's your favorite color? And practice going to ask kids in the library just what their favorite color is. Things like that to kind of help them face their fear of engaging with other kids. So school-based treatment intervention. And the second intervention I found was basically helping your children at home. So these were 5 ways. I won't go into detail for all of them. I'll just list the 5 things. So they're pretty self-explanatory. The first one was talk to your child about finding solution when a problem arises. So just teach your children to have an I can attitude. This is just replacing negative thoughts with more positive ones. Like instead of thinking I can never talk to somebody on the playground, I don't know, tell them you can do that. Like you really can, just kind of get that in their heads. The third one was teach them the importance of deep breathing, teach them, how to calm down when they do start to feel anxious. The next one was sorry if I'm going too fast, I can go over them again. Help your child understand that not all fear is the same. So their fear, like if something makes them feel more anxious than something else, maybe they can start to think of one thing is not as scary as something else, and that kind of helps start the process, maybe help them overcome one fear at a time. And then the last one is reassurance. Reassure your child that no matter what happens, that you're proud of them and you love them. So this can be if kids are scared if they, fail a test, or if they get laughed at, or anything like that. Like they tend to think that they're going to be a failure if these things happen, and just kind of reassuring them that no matter what, that they're not a failure, and that you still, are proud for whatever attempts or things they try. So, the essence of my social anxiety research.
That's interesting.
Yeah, it really was. So I liked the school-based treatment a lot because that made a lot of sense. Because I think most social anxiety does happen at school. So with kids in the age group that we're talking about, especially. So.
And then it gives them real life opportunities to try those things out.
Yeah, I really liked that.
Well, and at school too, that's where that's the most vulnerable stuff. And at home it's not. And, generally in the neighborhood it's not. They're used to that. They've done that so many times at school. It's all unknown. Not unknown, but you know what I mean.
Yeah.
Mm-hmm.
So, Victoria,
I agree.
Remind me again, it was anxiety. What was your topic?
Social anxiety.
Social. Okay.
So
Okay.
yeah, then I mostly talked about school-based treatment and just what parents can talk to their kids about at home.
Okay. Okay. Do you mind if I go next, Bree?
No, that's great. I'm still, so I did mine. I think I did mine a little bit wrong, so I'm trying to figure out in my head how to reorganize it all. Anyway, yeah.
Okay. So mine was a little bit similar to yours, but I had a little bit different take, Victoria.
Okay.
So mine was on anxiety, but I kind of researched how to help kids with anxiety. So it's kind of along the same lines, but a little bit different. I found 2 articles, but one I liked a lot better than the other one. The one that I liked was Child-Centered Play with Young Children Who Are Anxious. And this article kind of talks about CBT, which is cognitive behavior therapy, and how they tried that in young children, but it wasn't as effective as it was in adults because children kind of live in an egotistical world where they're kind of self-centered. Their whole world revolves around them. And so that was hard. That kind of therapy was harder for kids to relate to. And so they found that this play therapy was more effective for these kids. They found that, I'm just looking through this article here, when kids would play out a situation with toys or with stuffed animals or something like that, it kind of gave them better coping skills to be able to deal with the situation when they were presented with it. Children will be more likely to move toward these experiences, and they call this CCPT, which is child play therapy. It helps to give them more of a sense of self and more of an integrated self structure. It helped them, and the study found that when they did this kind of therapy with these kids, that it helped reduce their anxieties versus using the CBT traditional therapy. So that's kind of in a nutshell, this article that I studied. And the other article that I researched was the mother-child emotional communication and childhood anxiety symptoms. And this article wasn't as helpful as the first article was. And I chose this article, or this topic, because my 9-year-old, Allie, she has been struggling with fear. When I put her to bed at night, she has a really hard time letting me turn off the light. She has a really hard time like shutting her mind down and turning it off so she can fall asleep. And then if she wakes up in the night, she's up all night worrying. If she watches anything scary on TV or even remotely scary on TV, she gets really scared and really nervous. And so I was looking for ways that could help her learn to calm those anxieties. And so we've started talking about with her how things that she can do to talk herself through calming down. So we've talked about thinking about good things and talked about trying to get her mind back on track to where she is in control of her mind. And then this article kind of helped me to realize that how can I help her through play, or maybe ask her how she would help a friend or her someone that she might know who's struggling with being afraid at night. How could she help someone else? So they kind of relate a little bit, and that's how I've implemented it a little bit with that anxiety and helping her to calm that anxiety. And then thought about how I could use this play therapy to help her kind of calm those fears and those anxieties. So that's kind of the route that I took.
That's great. Somebody had mentioned child play therapy on the discussion board as an intervention for anxiety. I hadn't really heard before, so I asked her what it was, but like to go into detail about it, but I didn't hear. But that's great. I'm glad you did that. It's really interesting.
It is interesting, the centered play.
I mean, it makes sense that I feel like teaching a child to think about things differently when they're, pretty young might be kind of hard, like for them to really grasp those concepts, like in cognitive behavioral therapy. But yeah, with play therapy, they can kind of, it's doing what they're already doing with like pretending and playing with things that they have. And so I think that would be great to help them. So.
Okay. I'm going to go, unless you have something else to say. I assume you did. It's so weird to see you guys, but you guys can't see me.
It's funny. You're there. You have like a blank little face.
So I did mine on perfectionism, which was really interesting. And basically, it was saying that there's been lots of studies done on, teenagers or college students with, perfectionism, and they're saying younger people are struggling with this, and there are bad things or consequences, or I can't come up with the right word, that come from perfectionism. And they did them in they categorized it two different ways. One was socially prescribed, and one was self-oriented perfectionism. And so it basically did a study of 3 factors: 1 socially prescribed and 2 self-oriented. And the higher levels of perfectionism that were found among the participants were from China and Russia, are keeping with the descriptions that they have to be perfect, which I thought was really interesting because the study was, in different countries, which was interesting to me that the Chinese and Russians felt like they had to be more perfect than in the other countries. And so
that's interesting.
And so self-oriented perfectionism was correlated positively with school effort and school enjoyment, but if it was socially, there was no link, which I think is true. And then it was saying that social or self-oriented perfectionism was associated with significantly with intrinsic factors, So if their perfectionism was self-oriented, it was more of a good thing and it had a better outcome than if it was socially.
Really?
Interesting.
Why do you think?
Which I thought, it was saying that it was talking about them enjoying school more, that they don't feel, socially, when it's socially prescribed, it was saying that they are feeling the pressure from parents and from other kids at school and had to perform, and so that led into my other article with the negative effects. But I thought it was interesting that if it was self-oriented, then it would be obviously intrinsic, and then they enjoyed school more, and it was a more positive outcome. And then the other one I did was the negative. Effects in perfectionism, and it was talking about the theory that there's negative effect puts an individual at risk for developing perfectionism through increased distress, emotional reactivity, and decreased suitability. And it was saying that children that were struggling with that, the study was shown that they did years later. And so basically, sorry, what?
That they struggled with perfectionism later? Is that what
later on, yeah. So okay. It was a study with 7 to 13-year-olds, and so it was saying that if they showed signs of that later on, they would be more likely to struggle with perfectionism.
Okay.
And it was saying that the socially prescribed perfectionism, I cannot talk. Perfectionism was found, there was a relationship between anxiety and depression.
Mm.
But if it was self-oriented, it was found the negative effect was worry.
Really?
Anyway, so I just thought it was interesting that, you know, where the school, the academic setting, that the social, you know, had a worse outcome and the self-oriented had a better outcome. And it kind of showed.
So would like the interventions for that be like, I don't know, simply like parents putting less pressure on their kids, being more encouraging of like the work that they do, maybe teacher, I don't know, like what do you guys think the interventions would be? Did it say, Bree?
No, and that's where I did it wrong, and that's why I was confused, is I just read those 2 studies and thought, oh, that's great, but so I don't actually have any.
Okay.
It didn't say, it was just doing studies. So,
gotcha.
I'm trying to think of.
You know, it's interesting you chose that, because I remember there was an article I read at some point written by Elder Uchtdorf, I believe, or it could have been Bednar, but one of the apostles, and they talked about perfectionism in the church, among church members, and how that perfectionism and that strive for being perfect, because I mean, one of the commandments in the scriptures is to be therefore perfect, but it's impossible. It's impossible as humans to be perfect. And he addressed how to be working toward perfection, but knowing that it's not possible, but yet the pressure that we put on ourselves to be perfect and to fit up to the Pinterest lifestyle or the Pinterest house, or, you know, whatever your neighbors are doing, and trying to live that image that you see around you so prevalent. And so that's interesting that you chose that topic, because I almost feel like that is more prevalent among members of the church than other places. What do you guys think?
No, I agree. I see it all the time. I mean, and you see it like in your own words, you see it like on places like Instagram. I mean, it's just perfectionism and like the strive to be perfect is everywhere. And I mean, I think that it's kind of funny, because like things you hear in the media are very like, what's the right word? They're opposite messages, you know. It's like embrace like your natural self, and you know, people are always trying to be real, you know. That's always the thing, like real talk, I'm going to be real, but then at the same time they want you to be perfect while you're doing that. Does that make sense?
Absolutely. So. And social media, I think, is a huge part of the contributing factor to that perfectionism. You know, we all the perfect lifestyle that people live on Facebook and Instagram and Pinterest and all of these places that we are spending so much of our time on. But is it real? And people claim to be real, but it's not.
That's true.
Which is interesting with the study, because it was saying, I would call that social prescribed perfectionism, you know, the social perfection, you know, and it's saying that the effects of that are anxiety and depression. And I think that that's true. Whereas if you know, if it's a self-oriented, you know, like different kind outside of the social, then you just worry, which I thought was interesting.
Yeah.
I think that's true. So, like going back to talking about kids like between ages 6 and 11. So this is something that I've actually struggled with since I was a kid. Like this need to be perfect regarding school and grades. Like I've always had something that I like. My parents didn't put a lot of pressure on me to do well because I put all the pressure on myself. Like when I was little, like they didn't have to because I did it for them basically. And so. And I worried all the time about school and grades. And I mean, I got straight A's, but I worried. So that the self-oriented perfectionism, you know, it is different than the socially prescribed perfectionism, but it still is like a problem that, you know.
Yeah, but it has better outcome than if it's just pure social.
Right, exactly. Exactly.
Which is interesting to me. That's very interesting.
Well, I don't know what to put for the interventions, I guess, for the end of, you know, when we talk at the end.
Well, I think that for like what you talked about, I mean, there might not be a whole lot we can do about like society and what they say necessarily like as a whole, but I think that, you know, maybe parents and teachers and communities and like church leaders and all these kinds of people can kind of help people, you know, I'm trying to think how I would say this. I don't just encourage people for what they are good at and like help people develop their talents and make them feel confident in what they can do and just kind of teach them that, you know, their effort matters, but they don't have to be perfect, I guess. I don't know if I'm making a whole lot of sense, but just kind of, I guess, not basing their outcome, like what they do on their like personal worth. Does that make sense?
Yeah. I think the biggest thing is just education. If people understand that we all feel those social pressures, and making people aware that these social pressures are weird and or not weird, but they're there and they're real. Then
they're weird too.
Yeah, exactly. Then
they're random.
That's half the battle, is just letting people know that this is actually an issue. I mean, had you not brought that up, I wouldn't really have thought that that was an issue. So just being aware of that, I think, is a huge intervention. You know, making people aware that this is going on. Go away.
Okay, I like that. Thanks. Sorry, obviously I didn't research totally correctly.
Bree, all you got to do is just turn it and it'll be perfect. Just say the things that we just helped come up with and it'll be fine. I don't think you'll have to stress about it.
Yeah, you're fine. Yeah, you didn't do it wrong. You found articles on what your subject was. Just because they didn't say interventions, we still came up with them. So I think you're totally fine.
Just call them those interventions and we'll call it that.
Yeah, exactly. You're doing great. Okay. So at this point, we're going to go to an hour. So let's really fast go through the domain interviews that we conducted with the parents or caregivers. Do you guys remember? I mean, that's what we based all the discussion boards on the last couple weeks. Mine,
What's that, Bree?
So for my interview, sorry.
You're fine.
Sorry, I was just asking what our time was at.
I think we're at like 35 minutes. So, I mean, we still have like the 15 to 20 minute section coming up. So I think that we can do that fast.
Okay.
I interviewed 2 people. I interviewed a dad and I interviewed the Activity Days president in my ward. And really, I mean, I'll just do this really fast. It was basically a lot of the things that we talked about on the discussion boards. When I talked to the Activity Days leader, we talked a lot more about the social and emotional domain because she saw that, you know, she works with girls 8 to 11 a lot, and she sees the social problems. The self-confidence is a big one. She sees the bullying, those things. I mean, she sees girls struggle a lot with self-esteem. Some girls than other girls, and that can cause problems in their social emotional. They can start to feel, you know, either embarrassed or better than other people. It goes into the way they dress, it goes into the way they talk to people. About like the bullying thing, there's a girl in her group who is bullied at school, and like they're trying to work through that and teach her how to, you know, stand up for herself and things like that. So one of the interventions we talked about there was, you know, tell an adult that you trust, a parent, a teacher, and then, you know, if necessary, the parents and teachers can talk to the other student, can talk to the parents, and also teach like children what to say. And one of the things that they talk about a lot is when someone bullies you, like acknowledge that they're being a bully. Say like straight up to them, like, you're bullying me right now, and I don't like it. So things like that we talked a lot about. With the dad, I talked about, let's see, what did we talk more about? Talked to some about, and all of them, those are just that's just with the activity days leader, it kind of went to the social emotional one. I think, oh yeah, the dad, we talked a lot more about the physical, like milestones and things that children and like problems they have. We talked a lot about nutrition and kind of like obesity and exercise and PE in schools and all those kinds of things that there needs to be more education about it, and there needs to be like more of a group effort between parents and schools and everything, because it's great if parents are trying, but if schools aren't, then it kind of takes away from the message, and same vice versa. So, you know, encouraging physical activity at home and at school, encouraging healthy eating at home and at school, things like that. So those were some highlights from my interviews.
Awesome. You had a much different interview than I did.
Well, tell us about yours.
Mine was with a dad with 3 kids, and then a mom with 2 kids. Hello. And both of them, it was really interesting that it kind of felt like the same interview, even though they're not related or anything like that.
Right.
And it was interesting that one of them, the dad was talking about recognizing emotions and how that's a problem because kids are just on electronics, and it's kind of that virtual world these days, and that they don't know how to communicate or read body language, and how that's becoming such a big problem of communicating, and that there's not enough play. And the mom was saying the same thing, that there's not enough play, that kids don't really know how, that they're very exclusive. And since there's not enough play, they're not seeing it through example, and they're not taught how to play. So that was basically, in a nutshell, my interview. So it was the same, but not.
Oh, that was great. It's interesting that they said the same things too, even though they weren't different from different families.
Right. I mean, it kind of felt like the same interview in a sense, but yeah, It was interesting.
That's cool. Okay, so I interviewed 2 teachers. One was a preschool teacher, and one was she had been a reading interventionist, and she is moving to 2nd grade, but she's been a school teacher for years. And we talked a lot also about the lack of physical movement. And that was one of the things that I did, was just living a sedentary lifestyle, not getting out and moving enough. We also talked about how parents don't really understand that kids have all of these needs that need to be met, and how important each need in each area is, and how parents are really undereducated when it comes to those things. She talked a lot about the reading interventionist teacher, ironically, talked a lot about how important physical movement is, and how kids have a natural desire to be physically active, and how those things are really hampered when we give them screens. and TVs and, you know, video games and all of these things, and how important recess and PE are in the schools, and how those things are getting cut out of schools because this drive for education. But it's so important for their brains to be able to work, to have those physical breaks. The other teacher talked a lot about how language is such a key element. Language development is such a key component to development. A lot of the interventions, when we asked about interventions, about things that are available to kids, the one teacher was really specific. I mean, she talked about how there's occupational therapists, there's PE classes, there's adaptive PE, there's scouting and day camp and summer camps and city rec programs, and all the things that are available to kids that families don't take the time to, or don't have that access to those resources to help these kids out. Anyway, that's kind of it in a nutshell. We just talked a lot about the physical needs that children have and how important those are. And if those needs aren't met, then they struggle in other areas to develop and grow in the cognitive and social emotional when the physical aren't being met, and vice versa, how they just really play off of each other. And they're all so important, and they all need to be supportive in order to have a whole development. So that was pretty much what our conversation was.
That's interesting. Do you know what's interesting about that is that we were in Kentucky, and the school district encompasses the entire Louisville metro area. So in this one school district, there's 120 something elementary schools, and they have cut it to where there's one recess a day, and it's at 2:45, 40 minutes before they go home for the day. And they can't figure out why they are having behavioral issues in the school. I'm like, really?
Oh my gosh.
Come on, guys.
That's terrible.
They, after lunchtime, they get, no joke, from the time they leave their classroom door till they line up after they eat, they have 15 minutes to eat. Go through the line, sit down, eat, and dump their tray and stand in line.
Wow.
So they're hungry and
cooped
they've
up
been sitting all day. Oh yeah, it's nuts.
Wow.
That's crazy. I feel like that should be illegal.
I know.
Sad.
Wow.
Yeah, the entire Louisville metro area. Yeah.
That's unbelievable.
So nobody wants to live.
Seems like it would.
Everybody wants to live outside that county because the schools there are so horrible.
They don't get recess.
Well, and they're also bused all over because it was with the integration back in the day. So kids will be on the bus for sometimes over an hour and a half each way.
Oh my word.
I mean, that's rare, but
yeah,
it happens. It's crazy to me.
Wow, that is crazy.
Anyway, so that's interesting that it goes with the physical activity because that also affects their cognitive and their social and all of that, the physical activity.
Yeah.
Wow. Well, thanks for sharing that. It was really interesting and tragic, really. So let's go through really fast and see our let's see, we've almost hit an hour, so we can just kind of wrap this up. So the attempt to identify common elements of effective interventions targeted to different problems in different domains. So honestly, I think that we were talking about this right now with recess. I think that is a huge thing for physical and cognitive and social and emotional. It teaches kids how to play with each other, how to make friends. It gives them those opportunities. It gives them the physical activity to be healthy, and, you know, helps them learn when they've been active. You can learn better. And so, I mean, that's a huge intervention right there.
Absolutely.
So, I mean, I think that really when we've talked about our interviews, we've kind of talked about a lot of the effective interventions.
Yeah.
Like, Amberly, you listed a lot with who interventionists talked about. Like, those were great. So
yeah, she really helped me to see I mean, she even mentioned like doctors and nurses and how they play a part in making sure the kids are active, you know. And I mean, even
I think that
go ahead.
Sorry.
No, go ahead.
I'm sorry. I thought you were done. Oh, I was just going to say, I think that probably the biggest common like element of all of our interventions is education. And like you saying, you know, the doctors and nurses educating patients, and just all of it all comes down to educating people. And so they know what to do, because if they don't know, then they're not going to do it. So
yeah, exactly. And that's the way it's going to make a change. Like if people are educated, this is why you need to do this. This is the benefits of this. This is why this is important. Then they choose to make the change themselves versus, which this is a side topic, but it drives me crazy when they want to like take away soda, which I get soda's not healthy, but why take away the choice? Provide education so people choose to make that choice for themselves.
Right.
Definitely. Okay.
Well, it's
perfect.
just like to a little kid, you know, you can tell them don't touch the hot stove, but if they don't know why and what's going to happen, they're not going to listen. Still, I mean, now you know a little kid's a little different because they don't know, but it's the same kind of concept.
Exactly.
Oh,
exactly.
Yeah. It's true, because I mean, they can still choose to touch the hot stove if they want, but they're going to get burned from it. So if you teach them that before they do it, then, you know, they'll be helped. So that's a great example. Yeah. Okay. So let's conclude by sharing our best general insight or suggestion about effectively intervening to foster optimal development. Well, I think that we just kind of said it. I guess we kind of, the education. Yeah. Teach them what to do, why to do it, how to do it, you know. It can be with anything. It can be with bullying, it can be with speech therapy, it can be with anxiety, all of these things, you know. Teeth brushing, you have to educate people and teach them. I mean, if children are struggling with speech, you have to educate them. You need people who can help them, you know. I mean, it all just comes down to that. So I think that's our best general insight.
Yep. Okay,
awesome. Okay, so let's do our final 2 minutes. So would anybody like to do it? If not, I can, but if anyone wants to jump in there and do the summary, you can go for it.
I mean, I'm the same. If nobody wants to, I can. But
I'll do it.
Well, you did it last time, so I don't want to make you do it again.
Well, just jump in if I miss something. How's that? If I forget something, then just jump in. Fair. So just to summarize, we talked about our dental assignment where we did education on dental care, where we each did a section. We talked about pacifiers and bottle use, and fluoride and using fluoride and proper toothbrushing, and snacking and nutrition, and how all of those things factor into dental care in children, and educating parents on on all of these issues really provides a better opportunity for kids to have long-term dental health. And then we talked about the, let's see, we did I'm drawing a blank. What did we do after that? We talked about the
Victoria and the social anxiety.
Oh yeah, we did each of our things. So Victoria talked about her social anxieties and how the social anxiety as the intervention was school-based, and how having school-based was helpful for those kids dealing with that because it was in a real-life situation. And then I talked about how to do home interventions and how you can talk to your kids, help them to have a positive attitude, do some deep breathing, and then reassure them. So there was 2 different ways to help them with their social anxiety.
Perfect.
And then I talked about anxiety and how to help kids who are struggling with anxiety, and how play therapy has been helpful in helping kids because they have a kind of an egocentric, self-centered view of life, which is normal for children at this age of development, and how play helps them to be able to work through those issues of anxiety through play. And that was more effective than other different types of therapy. And then Bree, you talked about perfectionism and how there is two types, self-oriented perfectionism and social-oriented perfectionism. And it was interesting that correct me if I'm wrong, but the social-oriented perfectionism led to depression. Is that right? Am I getting that right?
Yeah.
Okay.
Yep. And anxiety. Yep.
Okay. And anxiety, and kids who struggled with that as children also struggled with that as adults. But the self-oriented perfectionism was typically more positive and helped to drive them to be better. Am I correct in saying that?
Mm-hmm.
Okay. Did I miss anything on those, you guys, that you want to add there?
No.
Okay.
No, I think that's great.
And then we talked about our interviews that we did. I know that myself and Bree, our interviews kind of were geared toward that physical element of being active and not living that sedimentary, I always say that wrong, sedentary, thank you, lifestyle is really inhibits growth in other areas. And how important physical activity and movement and education helps build those other areas. And then Victoria, help me remember what your kind of
I talked about a couple things, and I also, with the Activity Days president, we talked a lot about the bullying in the social and emotional domain, like self-esteem and things like that.
That's right. That's right. Self-esteem and how bullying, talking about it helps them to become more aware, I guess. I don't know. Hopefully.
Mm-hmm. The education with bullying and kind of helping kids to become their own advocate and like with bullies and things like that.
Okay. So I think kind of the bottom line for those interviews was, and kind of across the board for this was, boy, education. Education is huge for parents and children, teaching them what and why these things are important so that they can make better choices for better health long-term across the board, both physically and cognitively and emotionally. You know, the more education, the more people know, the better choices that they can make, the more educated choices that they can make, and the better things will be for them. So that's kind of my take-home message.
Perfect.
That the more education we have, the better we will be off.
That's great. Perfect.